Every once in a while, you meet someone who's spent their whole life caring for others. And somehow, they're just getting started. My guest today is Patty Glick. She is a nurse practitioner with more than 4 decades in healthcare. She has seen the very best of what medicine can do and the limits of it. And instead of slowing down, she got curious. She started asking a bigger question. What if people have more power over their own health, their own growth, and their own future than they ever been told? That question became a mission. Today, we're going to meet the woman behind it. Not a company, not a product, Patty Glick. Patty, thank you for being here.
You're welcome. It's such a pleasure. I'm really looking forward to our conversation.
It's going to be fun.
Yeah.
Thank you.
Sure.
Before you were becoming a nurse practitioner, so who is Patty Glick? Tell us about who you are.
That's a really interesting question. So who am I? It's interesting because I don't think who we are and our identity is tied to our career.
That's right.
Instead, I think it's really designed to who we are in our heart and what we believe. And for me, I would say I'm a woman who cares very much for her family. Family is very important.
Yes.
Being able to provide an environment where my children could grow up and now my grandchildren and really live their life to their fullest potential. But it extends beyond that and extends, and I think that's why I went into nursing, is because I think it extends beyond that to being somebody who can help others see that potential in themselves.
That's right.
Yeah.
I think family, you mentioned, family is everything.
Yeah.
Having a foundation, right?
Yeah.
Family is and being able to do things because you have a bigger calling, because you have family, because people the surrounding people that you love. So this is great. Now, I would like to know what got you. Why? I mean, you could have gone to medical school or choose another career. So nursing.
Yeah.
Tell me about
That's
that.
interesting. I would say when I was in high school, actually, it probably started when I was in elementary school. I'm just remembering the story as we're talking, and I was a little volunteer in the school nurse's office.
Mm-hmm.
And I remember, somehow it was in elementary school, and I remember a little kid coming in and he banged his finger, and I splinted him.
Wow.
Okay, so I was probably in 5th or 6th grade. Wow. I certainly got in trouble from the principal for that. But I was just fascinated even as a kid with the body and with science. And I think that grew as I went into high school. But I also started thinking, because again, like we talked about, family is very important. Mm-hmm. And I saw the life that physicians were leading at the time. And you almost had to put your family aside. Yeah. And so that wasn't something that I wanted to do. Plus, the other thing that really appealed to me about nurses is nursing gave me, in my opinion, a little bit more of an ability to connect with a person. We were always taught in school that nurses care for the whole person.
Yes.
The psychosocial being is what we were taught in school. Mm-hmm. And whereas physicians, and again, not to knock them because we're all part of a healthcare team, absolutely, but their focus was much more on the science and the medical and the medication. And I loved that, but I didn't want to leave the person out of it. And so I think that those things all together are what drew me into the nursing profession.
Wow. That is so amazing. Now, you didn't do nursing for a few years, or you have experience 4 decades.
It's a long time. There's been a lot of changes over time. So I graduated high school. I'll just tell you a little bit about the story. And I was the first one in my family to go to college. We grew up not having a lot of extra at the end of the month. Mm-hmm. And I worked very hard. I got great grades in school. I ended up getting a full ride scholarship to a private school because of my grades. And I did that. I went to nursing school. ended up making a shift from the first school I started at, took a little break, and wasn't just walking through some personal things in my life at that time. I ended up applying back a couple of years later, and I went to USC. I did my undergrad there. Then I worked in the neonatal intensive care unit for a couple of years while I went back and got my bachelor's degree, did that on the side.
That's awesome.
And then I applied to nurse practitioner school, and I got into a specialized program that was new through USC as well.
Yeah.
So, yeah.
You split another student finger. You worked so hard because you saw your parents did not have enough, and that motivated you.
Right.
And then what kept you going after 40 years? What kept you going? The passion.
Yeah.
What kept? I mean, nursing is difficult.
Yes.
Is a very tough field,
Yes.
right? Caring for somebody and long shifts and everything.
Yes.
You build some very good history, and
Yeah.
now is it more than passion?
Yeah, that's a really great question. I think it comes down to really thinking about intrinsically what motivates you. And I call that your why. Yeah. So why is it that you choose to do something? You think about in college, Pierre, you being a nurse as well. I mean, when we had an opportunity to go out and party with everybody over the weekend, or we had a test on Monday that we knew we had to be prepared for.
Yeah.
Right. And so for me, I would say the biggest driver is and always has been, how can I leave a bigger impact in the world? What is that going to look like? And I'm not one to slow down. I'm one to just keep going and to just keep moving forward into that direction, because my why is what drives me. And my why is, how can I awaken the potential in one person, whether that's in their health, whether it's in their abilities, capabilities to do something. What is that? And that, I would say, is probably the thing that pulls me. I don't know, is there a ceiling? I don't think so.
No,
I don't think so.
having the why is I think, in my opinion, is the greatest motivator, and know the reason why you're doing certain things, and nothing stopping you, right?
Simon Sinek, if you've ever read or listened to any of his podcasts, but he's really big on that. And so when you think about, for me, what I think about is what I want to create and what kind of legacy and impact do I want to leave? How do I want to show up for my children? Because I think as parents, our children watch us. Our children watch us with the healthy choices that we make. Our children watch us with every decision and every choice that we make.
Yeah.
And if our why is so strong, and that is what will drive us. And, I've always appreciated Simon for that.
Yes. If there is one lesson that your patient has taught you that nursing school never could, what would that?
Oh, gosh. Wow, it's going to make me cry, actually.
Oh,
So I would say that there are two. It's the same lesson, but it's two patients. And I actually never really thought about this until you asked me that question. There's two patients, but a similar situation. And I remember when I graduated USC, my first job was on a 40-bed ward. Half of it was surgical, and the other half were infected cases. And if you're familiar, USC, predominantly the population are very underserved and really have very low financial means. And I remember this patient, she had had surgery, and she was hesitant to go home. And I talked with her about what was going on. I was working evening shift at the time, so I didn't have the physicians. I could just sit with my patient. And to hear her story, she was afraid to go home because she didn't want to be a burden to her family, because they lived in a 1-bedroom apartment and there were about 10 people. And she knew that she was going to need care. That was the reason why she didn't want to be there. she was so grateful for her family, but that whole aspect of not being a burden. And so that really set with me. The second part to that, and they kind of go together, is I had another patient when I was in private practice, so very different, areas of healthcare. And my patient had 4 daughters, and her husband was ill. She was having to care for him and care for her children who were growing up, her 4 girls. And she always came in to see me in my OBGYN practice. She was always in a great mood. And I just said to her one day, she could sit there and complain, and she never did. And I asked her, I said, how do you keep yourself going? And she said, I have an attitude of gratitude every single day. And every day I do not start my day until I close my eyes and say 3 things that I am grateful for. And I think those are very powerful, powerful lessons.
Wow. This is so that those 2 stories right there is just so touching.
Yeah.
And those are the things that basically helping us moving forward, spending a lot of years caring for those that we know that they need someone
Right.
that would defend them, caring for them, be there for them, holding their hands, get them through those hard moments.
And they will open up and have a conversation, with their nurse when they feel safe.
Yes.
And when they feel heard. Yeah.
What is, through your career in the healthcare, what is it that in your experience, that most people get wrong about the healthcare after many years of practicing from the bedside, now having a practice? What is one thing that you think most people get wrong about healthcare when it comes to, for example, someone goes to the hospital, they're not so sure how somebody gonna care for them, or a diagnosis, or they come for one thing, next thing you know, something else happened. In your own practice, based on your stories, based on your experience over 4 decades of practicing, I know there are people out there, they're so reluctant to go to get help.
I think I'm going to shift that question a little bit. I think the biggest thing that I would encourage folks to do is to be an advocate for themselves. You don't have to settle for what someone says. Do your research, get a second opinion, and most of all, find a care provider that you feel a connection with, that they will take time with you, that they will look at you. You want someone that will look you eye to eye, that will sit down and talk with you, not stand at the door with their tablet in hand, charting while they're talking to you, but somebody who will allow you a space where you can feel heard and you can feel seen. And we need to be advocates for ourselves for that, but we also need to be advocates for our friends and family for that. So I would say find an advocate and be an advocate for yourself.
I mean, this is so true, because a lot of times we see patients that can't, they can't basically communicate. They come in for something, they cannot communicate what they're feeling, and they can be, being advocate for themselves. And again, sometimes they rely on us nurses. But yes, do your research and do what you could to get that information. But if you can't, trust someone, or call a friend, call somebody. But again, being your own advocate. Sometimes, unfortunately, I've seen in my career, is just like we have so many patients, basically they cannot speak or whatever. They rely on us, the nurses. But again, if someone out there, yes, definitely be your own advocate, do your own research, and then trying to get the best decision, right?
Yeah.
Now, how does from bedside, having your own practice, what was the mental shift? Like, how did you come about? Why did you choose women's health in the first place?
That's an interesting question. So I chose women's health because it was happy. That was probably the biggest thing. I think one of the things when I was a student nurse is I saw so many times when people were just not living their quality of life and they were just hanging on. And I didn't feel like that was the space for me to make a difference. But in women's health, it's generally a happy field. You're bringing babies into the world.
That's right.
Okay. And most of the things, if a patient needs surgery, they're usually things that are very fixable with surgery. It's also a big area of education. And education is one of the things that I really enjoy with my patients, with people in general. And so I think that gave me a combination of all of that.
That's awesome. Now, it's what is some strength and limits when it comes to traditional healthcare? What did those limits like teach you? Like when you see, as you're practicing, like I said, having your own practice, women's health, there are some limits. You've seen what you could do.
Yeah.
And when you're dealing with somebody who comes into you, like they have either the insurance or whatever the case may be, there are some limits. How do you navigate through those? Like, let's say you know in your heart, you want to do everything for the patient, but there is some limits. How do you navigate through those?
Yeah, I think that it is about being creative, and I think it is about listening to the patient and what it is that they want. I mean, as a healthcare provider, we have the knowledge. We are the expert, but we are partners in care. And so I think really it's involving patients in the conversation and taking things one step at a time. I think sometimes we can overtreat, over-order tests, over-medicate, but how can we find a space that is going to be comfortable so that we're making sure that we're dotting our I's and crossing our T's, but so also that the patient feels cared for and involved in the decision-making with their care?
I love the way you answer that, because as a nurse, and we've seen how things are being done. Like we see the patient comes in, we just basically throwing everything instead of, because the thing is we have to be fast, right? We have to be fast. We have this amount to seeing patients, whatever. Sometimes the patient leave the room and they have no idea what they were told. Is that sitting down with them, say, hey, we're coming for this. This is my plan for you. This is how we're gonna treat this. Take the time to listen to the questions, like in holding their hands. Say, okay, don't worry, make them feel comfortable, right?
Yeah.
So you listen to your patients and you basically holding their hands, and to me, and we can talk about that too, by making the patient feel comfortable and say, hey, have a clear understanding. This is what you have. This is how we're gonna treat it. And I think you probably seen that, the recovery time and how well they do, because they have a better understanding. Exactly. Okay, I want you to do this. Go home, do this, do that, X, Y, and Z. And of course, because they understand, okay, this is what I'm told, and by doing this, I am gonna attend this.
And I think what I would say is it's interesting because over the last 40 years, 42 to be
42.
exact at this point, right? How I showed up as a nurse back then. And right now I'm retired from clinical practice. But how my conversations are with folks at this point are very different, because it's now, rather than being a one up, one down, it's more of a relationship. And I think that, my my wisdom on this would be, and even for a younger nurse or nurse practitioner, anyone in healthcare for that matter, is don't forget to listen to your patients.
That's right.
And it's not even listening to the words, but it's looking at their body language. It's looking at their eyes. It's what they're saying that they're not saying with their words. Because when you can make a connection with somebody and involve them in their care, rather than being the expert and telling them what they need to do, they're going to be more in a partnership. And I think that that's really the direction that healthcare needs to go. Healthcare has changed tremendously. And I think now more than ever, we need to be advocates for ourselves and partners with our healthcare providers.
Wow, that is what you just said right just now. Oh my gosh, partnering with our patients, right? It's instead of using those medical jargons
Exactly.
and say things to them where they will have the better understanding, like say in detail. I mean, again, yes, like you said, it's changing because how many times we have a patient, we see them, okay, this is what we think we told them to do, but when they go home, they forget everything.
Of course they do. They only remember a small percentage. I think the stat is 30%. I might be wrong about that, but I think it's 30% of what we tell them. And how much of it do they understand? They didn't go to nursing school. They didn't go to medical school. They didn't go to PT school. They don't know the language. And I think as healthcare providers, it's very important for us to remember the communication is the result you get, right?
Yes.
And so I think that it's very important that we remember that connection. And are they really hearing? And are we really hearing what they're saying?
I mean, it's. I think in the U.S. we've spent so much money in our healthcare system, and we still have a lot of work to do. I think that by listening, I've seen so many patients coming to our our hospital, and knowing my background in oncology, and you sometimes having the word
Yeah.
as you have this diagnosis, and they have no, they're not thinking, they're not hearing anything, they're not listening because that diagnosis of already wiped. I mean, no one wants to hear
No.
this type of diagnosis, anything about cancer or whatever.
No.
How do we bring him back? Sit down. Okay, hey, we in this together. For physicians, oncologists, the whole team, we in this together.
Right.
Make the patient trust that they in our care, and it doesn't matter. We will get them through. We'll do anything that we do to make sure that we care for them. We see, like you said, holistic care. We see the whole picture.
Right.
So I think, like you said, by having a trust, patient to trust in our care, be honest with them, right? Now, I see you have the fire in you. What is next? What is Patty Glick working on right now?
That's an interesting question. So, I alluded, and I know you know this, but I left traditional healthcare 10 years ago. I had a private practice for 25 years with a female physician, and I loved every bit of it. But what I felt was a higher calling, and I felt like the exam rooms put limits on how I could interact and be of service to my patients. But what I also realized is I think one of the things that happens in healthcare is that we as healthcare providers get so busy and so focused taking care of everybody else that we forget about ourselves. And I think I just came to the realization that as much as I loved what I did, and I chose nursing for, very specific reasons, but I was working 60 to 80 hours a week. I was missing out on time for my family. My health was being neglected, physically, emotionally, all the areas.
Yeah.
And I just got to a point where I realized, how could I still be in relationship and of service to others, but maybe in a different setting. So that's when I started a wellness practice, virtual wellness. I did that for 16 years. Loved it because it gave me the flexibility, but yet an impact.
Of course.
And an impact in a little bit of a different way, because that was a true partnership with my clients.
Yes.
They were not patients, they were clients. I ultimately sold that practice 2 years ago because I felt like, what's next?
Wow.
What's next? And I had an opportunity to move over into a really new, exciting area of regenerative wellness. And so that's what Patty is up to now.
Wow. So this is so amazing for someone who's who's watching this right now. As a nurse from the bedside, building your own practice,
Yeah.
caring for patients,
Yeah.
and you can say that you have that sense of entrepreneurship. You have that
Yeah.
you call yourself entrepreneur because you build a practice. And now, can you elaborate more on that practice? So, how did you? What was the? Did you exit, and what was that process?
The women's healthcare practice.
Building that process from basically from ground up.
I had a friend who was a nurse practitioner, Carrie, and she had gone back to medical school. She's a nurse practitioner, goes back to medical school, and I knew her when she was an NP. And we had talked about joining together in practice because I wasn't an NP yet. So I was still a nurse. So when she finished medical school, I finished NP school. She set up her practice, got it up and running, and called me. She said, hey, hey, what you doing? And so the rest was history, and we built that out 25 years together.
That's awesome.
And what I loved about what we did is we were a fee-for-service practice. We were not contracted with PPOs at the time. And this gave us the freedom, much like you talked about earlier. We had the freedom to provide the care that we wanted to. We didn't have the insurance companies telling us what we could and couldn't do. And we had the ability to be able to work with our patients financially.
Wow.
And so that's what I was doing.
If there's any nurse practitioners right now
Yeah.
watching us and they have the slight idea of basically make that shift, talk to them directly right now. How did you build yours with your partner, and how can they be successful? And what was the driving force behind that to make you so successful?
So I would say, again, it goes back to really finding my why. My why was, how can I leave a bigger impact in the world? And I knew that I wanted to be there. I don't think of it as providing care. I look back at it as in a partnership with my patients who we're all women essentially. And how can I empower them to take that personal responsibility for their health? Yeah. So I would say get really clear on what it is that you want and why you want it, because that why is so important. There's a great podcast by Dean Grazioso, and he talks about 7 layers deep. So go back and watch that. And what he does is he talks about kind of peeling back the layers on an onion and doing that 7 times. Why do you want that? Wow. Why is that important to you? Why? And when you get down to that 7th layer, that's when you're really going to find it. And I would say get your family's support. My husband and my husband's family was so supportive of me. They helped with the kids. They helped us out financially, while I was going to school and building the practice and all of that. So I think you've got to be willing to make a sacrifice. Jim Rohn says, when you know what you want and you want it bad enough, you'll do whatever it takes to make it happen, right?
I love that.
And that's it. Follow your heart and don't allow anyone to put the lid on your dreams, because anything is possible. You've just got to be willing to work for it and shift when things don't go well, push harder on the days when it's hard, and just know that on the other side of it, if you are staying true to who you are and why you're doing this, and part of that why is service of others, you're going to have a big impact in the world.
there's a lot to impact and just what you just said, right?
Yeah.
Because number one, having someone you love and someone to believe in that dream, right?
Yeah.
Someone as you can call a partner. Tell us a little bit about that because this is something that I don't know many people probably experiencing. When you have someone to support you who can see the vision when you share it, even if they don't see it, but they believe, you know what? Even if I don't see it, but I believe
Yeah.
you will be successful. How can you talk a little bit about that? Like having someone who believe and who can believe in you and how just believing in you will motivate you to be basically like, accomplish so many things.
Yeah, I think it's important. And ideally, if you're married, that would be your spouse. Okay, but sometimes that doesn't happen. In my case, my husband has always been very supportive. My kids and my entire family, very supportive of what I wanted to do. But not everybody is blessed to walk through the situation. So I there are days. It doesn't matter if you're a student. It doesn't matter if you're someone that is just going and doing their job. They have a 9 to 5. Doesn't matter if you're an entrepreneur and you're taking on a new venture. We all have hard days. And there are days when we don't want to keep going, when we question ourselves. And so I think it's so important to really develop a group of folks that are supportive for you. It might be your family. It might be your spouse. It might be a best friend. You might need to seek outside mentorship, something along those lines, but having a support community. Maybe it's a group. If you're a woman, maybe it's a small women's group. If you're a guy, maybe it's a group of other men that are supportive of each other, but seek it out because it is worth it. If these dreams were put on your heart, they were put on your heart for a reason.
That is awesome.
Yeah.
So you work with a lot of people looking for more options in life, for some
Yes.
nurses, doctors, or retirees, people who feel stuck. What do you want them to walk away believing?
That's an interesting question because the question is, how are they stuck? Are they stuck in their health? Are they stuck in their career? Where are they stuck? That's
That's
the
why
question.
that's
That's the question. And I think the first is to, again, going back to what we talked about, is to really be in a space where maybe it's time to think out of the box a little bit. If you're looking at your health, I trained heavily in Western medicine. I mean, you couldn't get more Western medicine than that, right?
that's right.
But what I know over time is that I have become more open and curious. And I would invite anyone out there to become more open and curious about the possibilities for you in your health, for you in your career, and just for you in your life in general. We don't have to stay stuck. I grew up in a generation where with our parents, it was you go to school. Maybe a lot of my parents' generation didn't go to college. I was the first college grad in my family. But you take a job and you stay there forever until you retire at the age of 65 and you get a gold watch. And if you had a pension, you got a pension. If not, hopefully you saved your retirement, but you were also going to lower your lifestyle and live on Social Security, right?
Yep.
But we don't have to do that. We have options.
So many options.
We have options
Yes.
and lean into that and maybe start dreaming a little bit about what can be.
And I think this is so inspiring because for somebody who is basically stuck, is either a practitioner who's thinking of, you know what, I want to move, I want to step back, I want to go into different areas, but they don't know how to navigate that. Or they basically thinking about something completely different outside of
Yeah.
medicine. They
Yeah.
want to basically see. So basically, they have to, from what I'm hearing, say, if you're stuck, you have to understand exactly why you're stuck.
I think rather than understanding why you're stuck, I think it's getting clear on what it is that you want. Because when we focus, there's a concept called structural tension. This is what I want. This is where I am. How am I going to fill the gap from taking me from where I am to where it is that I want to go? Rather than problem solving, being in that creative process so that all of the things that we're doing, and Pierre, you've been doing this with your career, but thinking about making all the choices that are going to move us forward to where it is that we want to go. And I think letting go of our ego to the point where we can accept mentorship, have conversations, and be surrounded by a group of people that are lifting us up, that believe in us, and can guide us to show us the way. Because if we're going down a different path, we've not been there before. Lean into someone's wisdom. That wisdom is their knowledge and their experience. And I really do believe that that is going to shorten the path.
That's awesome. And what I'm hearing is this: be coachable.
Yes.
And
Yes.
and be that vessel to learn, to absorb.
Yes.
And you just never know.
Right.
And meeting people and what's the word I'm looking for? You're being around people basically who wants to see people who can elevate, people who wants to see you succeed.
They say you're like the 5 people that you hang around with most.
That's
right?
it. That's
exactly.
it. Now, Patty, when it's all said and done, what do you want? What do you hope people to remember about Patty Glick? What's that?
I hope that they will remember that they can accomplish anything that they want.
I love it.
Yes. That she left an impact in the world, that she didn't settle, that she awakened the potential in others, whether that was her patients, whether it was the clients in her regenerative wellness, or whether it was the thousands of folks that I have mentored in their entrepreneurial careers over the last 18 years.
Nice.
Yeah. I want to be seen as a leader who awakened and developed other leaders, but that was passionate and really did everything because she led with her heart.
Oh, that's so good. That is so good the way you put it.
Yeah, thank you.
And how can somebody, on this practitioner right now, somebody who wants to something different, better, somebody who wants to know about what you offer, somebody who wants to get to know Patty Glick, how can they get in contact with you?
Well, I will give you my information.
All right.
So, yeah, I would say my conversations today are around folks looking at a more holistic approach to their health. And like we were talked about before, you said, what can people do in this day and age in the arena of healthcare? Mm-hmm. I think that they can recognize that we have by far one of the best sick care systems in the world, right? If you get in a bad car accident or you have a serious disease,
Oh, yes.
Okay, this is where you want to be. But that is this side of the pendulum. I've shifted over to more in the wellness space, as you know. And I think that if people would take an opportunity to be open and curious and look at what are some of the things that I can do, what are those foundational health pieces, don't rely on the medical system to keep you healthy. The medical system isn't there for that. You're there for that. And all of the tools and all of the information that is available are there to help us to live a more holistic foundational piece. And that foundational piece to our health is what is going to keep us out of the healthcare system.
That is. Any last words?
My last words that I would say is I would invite you to think out of the box. Think out of the box with your health and really ask yourself, what is one thing that I can do this week that'll move me forward to living a healthier quality of life? whether it is looking at your diet, whether it's cleaning up the toxins in the environment, whether it's looking into some wearable phototherapy options, whatever it is, look at that. The second thing that I would say is really look at the life that you want to live for yourself. You're not your career. You're the person inside of you, and the career is a piece of that. Your job is a piece of that. So really think about that, and I would invite folks to think out of the box. I know that the folks that I mentor in the field of wellness, whether it's a healthcare provider who's looking to bring options to their patients while creating options for themselves, or whether it's somebody who's looking to make some shifts. Maybe it's somebody who's not even in healthcare, right, and they're looking at, what can I do? I never went to nursing school. I never went to medical school, but I have a burning desire to help people. I would just say, allow yourself to dream and reach out and get some guidance and some support with that.
There you have it, folks. So that is, whether you're a nurse or nurse practitioner or physician, or if you're not in the medical field, in this episode with Patty Glick, you can get, this is so inspiring. And if you are thinking about moving, doing a shift from whatever you're doing now, in this conversation we have with Patty Glick, you will find that I'm sure there is so much you can get from this. Patty, this was everything I hoped it would be. 40 years in, more than 40 years actually, you're still opening doors for people, for everyone watching. I hope you leave this conversation the way I'm leaving it. A little more curious, a little more hopeful, and maybe believing you have more say over your future than you thought you did. That's the Patty Glick effect. Patty Glick, thank you so much.
You're
this
welcome.
Chair is for you. You can come anytime.
Good.
Again, we'll put the information where you can get in contact with Patty Glick and look in the show notes, and I hope to see you soon. Remember, your health is your wealth. Take care of it. Take care.